All the sirens in the world weren't loud enough to sound the alarm for what was happening inside Tendercare Living Centre last December. Within a week of its first COVID case, 31 residents were infected. Another week later, 156 residents and staff were positive, and those numbers would keep careening out of control. James Ha could only watch from the outside, praying his 83-year-old father, Than Kim Ha, would survive the storm.
What are you thinking as you're watching this on the news?
I'm thinking, you better be putting in protocols to protect those who haven't been infected.
Tendercare did have a plan in place in case there was an outbreak. It had been in writing since the spring, when the first wave proved how deadly COVID could be inside a long-term care home. The plan was to use a vacant wing of the 4th floor to isolate any residents who were positive. Toronto Public Health says it verified it, and according to the document, Tendercare could set up the unit the same day. Staff, like this personal support worker, whose identity we've agreed to protect, say they were briefed on the plan at meetings.
They told us time and time again, in case of anything, the residents would be moved to the 4th floor.
But when COVID hit on December 4th, that plan wasn't put into play. And the crowded old home, where nearly all residents share a room, many with 3 and 4 people, was vulnerable.
What they were doing, and I was so upset, they were moving the residents from unit to unit. It was a big and huge mistake by moving the residents back and forth, so it kept spreading like that.
6 days into the outbreak, and a team from Scarborough Health Network came in to support Tendercare, pressing them to enact the plan. An email from the home to families the following day said, "We've agreed to move all residents positive with COVID-19 to our 4th floor. We have 20 vacant rooms." But the 4th floor was never used.
Everybody was like stunned because the residents weren't moving to the 4th floor.
And what did they say to you? What was the answer?
I think they weren't prepared. They were just talking, but there was nothing being done.
The company contracted to manage Tendercare, Extendicare, one of the largest owners and operators of long-term care homes in Canada, said staff were falling ill and they didn't have the resources to open the floor. It was now 12 days into the outbreak, and there were warnings. If this continued, everyone could become infected. Toronto Public Health intervened, ordering the home to separate COVID positive and negative residents. But by this point, 118 residents already had COVID.
I think it was way too slow.
So far, James Ha's father had not been infected.
Toronto Health, I believe, should have acted much more aggressively as soon as they are aware of the outbreak.
Toronto Public Health says the next day the home provided a new plan for separating residents and began implementing it right away. But 2 of the home's 4 doctors were sick, and staffing levels were plummeting. A call went out among a group of doctors on social media that Tendercare needed help. Dr. Kate Greenaway, a family physician, put her hand up.
When I arrived on Sunday and I started seeing these people that were very ill, certainly what I was ordering immediately was oxygen and dexamethasone. And then at some point later in that shift, one of the nurses just said, "Well, we don't have any more."
Any more what?
Oxygen.
They were out of oxygen.
Right. I sort of said back, I don't understand. Where do we get the oxygen? And they said, well, we have to order it from the oxygen company, but then they have to deliver it, and that takes quite a lot of time.
So without oxygen and without dexamethasone to open up those lungs.
Yeah, no, you're in trouble.
Tendercare says it tried to secure supplies, but the region was seeing a surge in COVID cases and resources were scarce. To Greenaway, the home felt frenetic.
It was pretty shocking to me that it was possible to seem so unprepared for an outbreak.
Greenaway was able to get oxygen and dexamethasone from Scarborough Hospital.
You personally made the call?
Right.
You didn't know who was in charge?
No, I did not know.
Tendercare says its executive director, Francis Martis, was in charge until he too contracted COVID. We reached him by phone.
We're just trying to figure out why the 4th floor wasn't used because would you be willing to do an on-camera interview with us?
No, I'm sorry, I'm not.
Tendercare says after Martis was infected, directors from Extendicare took charge, but adds decisions on how to separate positive and negative cases were guided by Toronto Public Health. Management did tell staff that if they felt sick, they shouldn't come to work, and they were screened at the door. But at least one employee we spoke with said she worked through her shift while her fever grew because she had no sick days left. Tendercare says it offered unlimited paid sick days for COVID, but multiple workers told Global News they knew nothing of this policy.
If you don't get sick days, you have no sick days in the bank, you won't get paid.
Management didn't say to you, if you're sick, we'll still pay you to stay home.
No, they're not going to pay you to stay home.
On Christmas Day, 22 days after its first case, Tendercare relinquished management of its home to North York General Hospital. Dr. Kevin Katz is the hospital's director of infection prevention and control.
It was widespread, and the transmission was rampant at the time that we stepped in right on Christmas Day.
Stabilizing the home became the focus for Katz's team, and they recruited 50 doctors from across the province.
Was Tendercare ready for the second wave?
Well, clearly not. I believe every long-term care home was asked to fill out a preparedness survey, and they were all told formally that they were accountable for infection prevention and control, but clearly they weren't ready to manage what they experienced.
This is the preparedness assessment Tendercare filled out in August, months before the outbreak. It ranked itself 4 out of 5 near the top of the scale for readiness in every category, including infection prevention and control, stating audits are done monthly and training is provided to all staff. But put to the test, those on the ground said there were gaps.
I think it's clear that the issues when we went in related to training and education, how they were using PPE, environmental cleaning. It's a repeated theme in all of these very, very large outbreaks.
Ministry inspectors had been flagging issues at Tendercare for years, including at the beginning of the outbreak, when they documented widespread problems with infection prevention and control and improper use of PPE. Tendercare told Global News it takes swift action to fix issues raised in ministry inspections.
They should have just declared this a disaster zone and moved in as soon as their inspectors sent in their report.
It was early January, fully a month into the outbreak, when James Ha got the news he had been dreading.
My worst nightmare came to reality when I learned the beginning of January that he was infected.
His father was transferred to hospital, where he would spend 3 weeks before returning to Tendercare, a much more frail version of himself. COVID had ravaged his body and, coupled with dementia, robbed him of his ability to swallow.
And then yesterday, he had some food particles that came into his lungs. And he died. He died basically of suffocation.
Than Kim Ha isn't included in the staggering death toll at Tendercare, but his son has little doubt, had he not contracted COVID, he would still be here.
He would absolutely still be with us today. Yeah.
The owners of Tendercare during the outbreak didn't respond or refused to do an interview with us.
I'm trying to reach John. Is he around?
The president, John Doherty,
I will give him the card, and if he wants to speak to you, he will.
deferred our questions to the management company, Extendicare. Its CEO, Michael Guerrero,
We're trying to reach Dr. Greer. We have for quite some time.
wouldn't come downstairs to speak with us.
So my husband's probably on the phone.
Got it. Can I leave you my card?
In a joint email response, Tendercare and Extendicare said they responded immediately and through every available channel to get the supports needed to the home. But the stress on the health system in the region at the time meant that delivery of supplies, additional staff, and other support was not immediate. On February 1st, the outbreak at Tendercare Living Centre was declared over. 81 people were dead. All but 5 residents in the home of just over 200 people were infected, and 105 staff tested positive. Some continue to experience symptoms today. Other workers took COVID home to their families, infecting them as well. And among the unseen scars of COVID, the trauma of putting body after body into bag forced some workers to stay away even longer.
It's essential that we talk about what we saw because we want to prevent this happening in any other home.
There is deep sorrow among those who stepped foot inside Tendercare during those harrowing 8 weeks, and a growing sense of frustration that we should have done better.
There are major gaps, very, very serious gaps in the system that are letting these people down. And some of us went in to try to fill those gaps. This wasn't a gap that we could fill. There was a systemic failure somewhere in the system that allowed it to come to the levels it had come to when we walked in.